And I'm gelling as I come in. All right. Good morning, Mr. Riley. Sorry, didn't let you talk at all, did I? I'm your nurse today. I'm Professor B. I'm going to do a couple of assessments on you. I'm going to check your vital signs. I'm going to check your skin and just a few other questions that I'll ask. Probably gonna take me about 15 to 20 minutes. Is that all right with you?
That's okay.
All right. So the first thing I want to do is check your armband against the doctor's orders. And I would like for you to tell me your name, please.
Jeremy Riley,
All right, and date of birth.
March 4th, 2000.
All right, so the medical record and everything matches. All right, so we're doing really well so far. Now prior to me coming in, I had already set up my equipment, okay? But you will have to be sure your equipment is set up because you don't want to have to stop when you're doing an assessment and get out all your equipment. All right. Mr. Riley, let me ask you another question. Is it okay if I raise the bed up to a height that I can work with?
Of course.
All right, I'm gonna get you up a little bit higher. All right, that's just about right for me. I wanna be sure you're safe, so I'm gonna raise the side rail on your side. But I'll leave the one down on my side because that's what I'll be working from. First of all, I want to ask you about allergies. Do you have any allergies?
I'm allergic to penicillin.
And when you take penicillin, what kind of results do you get or what kind of interactions?
I get itchy and break out in hives.
Okay. Well, I noticed you don't have on your doctor's orders any penicillin ordered, so you should be safe there. Have a few questions that I'd like to ask to test your level of consciousness. Can you tell me where you are right now?
I am on the medical surgical unit.
All right. What time is it? Either time of day, day of the week, or year?
It's late morning.
All right. And tell me why you're here today.
I was in a motor vehicle accident.
All right. That sounds kind of rough. I'm looking at the patient. The patient is partially dressed for the assessment right now, but does have cover. Has on a hat to keep his head warm, and is lying in bed at probably semi-Fowler's position. Cognitive ability is intact because he can answer my questions appropriately, and he's following my thought processes in a logical manner. I need to check your vital signs first, as I said. So I would take your temperature, and for that, I just use an infrared thermometer. I'm also going to check your pulse and your blood pressure. So I just need your arm for a minute. Okay, I'm just gonna lay it across your chest. Okay, we have a pulse of 68, and the respirations are 14. I check the blood pressure, and the blood pressure is 120/60. And if you had a finger, I would use the pulse oximeter to check to see your oxygen level. Okay, so your oxygen level is 94%. Thank you very much. So I'm going to remove the cover, and you do have on shorts, so I'll try to keep this as brief as possible so that you won't get too cold. So I'm observing first, I'm doing an inspection of the skin. Okay. So I see that the skin is, he looks well nourished. Let me ask you about diet, since we talked about nourishment. What kind of diet are you on?
I'm on a regular diet.
Okay, so no modifications are needed.
No.
So the color is uniform throughout. It is consistent with the ethnicity of the patient. As I'm looking at the skin, everything is symmetrical. The skin color is even toned, okay, down to the legs. But one thing I do notice is that on the right leg, there is a 6-inch surgical incision. It's at the right lower leg. It does have a dressing on there, but you can see through it, and I see some serosanguinous drainage. I don't see any redness around it. I do see a 4-inch incision on the lower left leg, and the dressing is clean and dry. The patient does have some first-degree burns on his arms, bilateral arms, from the airbags exploding. And then I also notice on the face, he's got bruising on his forehead, on his nose, on his chin, and that's from hitting the front of the car. All right. Since you do have incisions, you just had surgery, can you tell me, is there any pain associated with that?
I have a pain from 8 out of 10 in my lower extremities.
Okay. We will be sure we give you some medication for that to help that pain.
Okay.
All right. So I'm going to do the palpation, and we're going to start with your hair. And when I check in the hair, I like to put on gloves. Okay. So I'm going to move the hair around. I'm going to move it into sections. I want to see if there are any lesions in your hair. Also checking for any infestations like lice. And I don't see any. I see no lesions. I see no infestations. And just to save time while I have my gloves on, won't have to take them off again, I also use gloves when I assess feet. So I'm going to go ahead and assess your feet. I'm going to check for edema, which is some swelling. Okay, so you're going to feel pressure for just a few seconds, then I'm going to let off on it. Okay, and there's no edema of the feet. I'm also going to check your toenails, what we call capillary refill, and so I'll be checking each one of your toenails. And I'll do it bilaterally, so that I'm checking each nail at the same time. Capillary refill is less than 2 seconds. Okay, shouldn't need my gloves anymore, so I'm going to take those off. So I'm going to call what we palpate. That means I'm going to touch your skin. And is it all right if I touch you?
Yes.
All right. If at any time you feel uncomfortable, be sure and let me know and I'll stop. I'm going to use the backs of my hands, which is called the dorsal area, because it's more sensitive to temperature and I can tell better the warmth of your skin. Okay, the skin is warm and dry. The texture is a little bit rough. I don't feel any nodules. I don't feel any indentations. I'm going to roll you over. I know that your record says that you have to have some help rolling from side to side. So I'm going to let your head down just a little bit because I need to check right down around your bottom area. Okay, not completely flat, but kind of low. Now, if you can put your arm on the side rail, I'm going to help you roll over. All right, good. So I'm checking your back. I'm looking at it for color. It's consistent with the color of the rest of your body. I'm going to check for edema. Should have kept my gloves on. All right. So there's nothing there. And we're going to roll you over to the other side. So I'm going to raise this side rail. Okay. And I'll go over on the other side and help you turn. me out a little. You reach that side rail, so we're turning you over there. I don't see any redness on the skin on the shoulder areas where there are bony areas. Again, the skin is warm, it's dry on the back, maybe a little bit damp right on the sacral area, but I do not see any edema. All right, we're gonna let you roll back over. Okay. I'll raise this side rail back up because we're going back over to the other side. I'm going to do a little pinch of skin on your chest. It's right under your collarbone, and this is where I check the elasticity of your skin, and I'm going to check the turgor. So just a little pinch, it won't hurt you, all right? The skin is very elastic. The skin turgor is good, it's not dehydrated. It immediately goes back to its original position. There's no tinting, all right? I'm going to check the nails of your hands. I've already looked at the nails on your feet. So the nails on your hands are clean, they're smooth, they're well groomed. Let me look at these. All right. And the base of the nail adheres well to the skin. Around the edges, it's smooth. I'm going to look at an index finger. Okay. Index finger. There's no clubbing, which would be associated with COPD. I'm going to go ahead and check the nails for capillary refill. Okay, capillary refill is less than 2 seconds. We have checked edema on the sacral area, and I did check edema earlier on the feet and the ankles, and there was no edema at that time. Do you have any questions for me right now?
I do not.
Okay, I'm going to do what we call a grading scale. We're going to figure this and look at the numbers. Okay. So first of all, is the patient able to respond meaningfully to the pressure-related discomfort? Okay. The patient responds to me touching the skin and everything, so I don't see any impairment. Moisture, I did say there was a little moisture on the coccyx area, but the rest of the skin was dry. So I'm going to say maybe occasionally moist. All right. So right now I have got 4 for no impairment, 3 for occasionally moist. Somebody keep up with the score. Activity, well, he's bedfast, remember, because he had both legs operated on. So he's confined to bed, so we're going to give him a 1 on that. Mobility, he can help me a little bit, but not much. So he can sort of make changes in his bed position and all. So I'm going to say he's limited, which would be very limited, which would be a 2. Nutrition, he's on a regular diet, he said. And Mr. Riley, do you eat most of your meal?
Yes, I do.
Okay, so eats most of the meal. So we're going to say that he's got excellent appetite. That would be a 4. And he does require some help, I would say maximum assistance in moving. So we're going to give him a 1 on that. So what is our total score?
15.
Did anybody figure that out for me?
15.
She said 15.
15? Okay. Does this give us a score for Braden? If it is a 15 to 18, he's a mild risk for skin breakdown. All right. So, Mr. Riley, I have completed my assessment